Hi, I'm Dr. Nancy Andrews, and I want to talk to you about the Essure procedure. As a woman and an OBGYN, I want to provide my patients with the very best healthcare options. So when a woman has decided that she doesn't want to have any more children, I talk to her about the Essure procedure. Women are naturally excited to learn that the Essure procedure isn't like the outdated tubal ligation. A tubal ligation requires surgery, general anesthesia, and several days of recovery. With Essure, there's no cutting into the body, and we perform the procedure right here in my office with no general anesthesia.
They're familiar with our staff, with the setting here in the office. Hospitals can sometimes be a little bit intimidating and frightening. So that anxiety issue is not there when it's done here in the office.
Birth control, if you go the permanent route, it always involves, surgery and hospital stays and being, out of commission for a certain amount of time. And with the Essure procedure, the next day I was fine.
The procedure was performed in my doctor's office. Very comfortable setting. I was in and out in 2 hours.
I had the procedure done on a Friday. I went into the doctor's office. He had given me a sedative to help relax me. During the procedure, he told me everything that he was going to do, how he was going to do it. He even had a monitor that I could watch while he did the procedure. As far as any pain was concerned, I didn't have a lot of pain. It was more of pressure. I felt pressure, but nothing like what I experienced during my menstrual cycle.
I went to the procedure. It took about 45 minutes. They locally just numbed up my cervix and placed the coils into my tubes, which I got to watch on screen. And after 45 minutes, it was done. And I left. I went shopping, did great, went home, and did just great.
Well, the benefit of the Essure procedure over, say, a tubal ligation is that the recovery is so rapid. The recovery is really measured in hours and not days, unlike a tubal ligation.
I love the Essure procedure because it was simple, it was fast, it was permanent birth control that I wanted. What I especially loved was no downtime. As busy as I am, a working mother of 2 children and running a household, I don't have time for downtime. I don't have time to be sick. My family depends on me.
And so when my doctor suggested Essure, I thought it was a great option. There was no surgery involved. There was no hospital involved. There was no downtime involved, and it worked out great for the both of us.
The procedure alone was great because the recovery, there would have been no way that I could have had a tubal ligation and think I'm going to recover from it with my 3 kids.
A tubal ligation is usually performed as a laparoscopic procedure under general anesthesia, where gas is used to expand the abdomen so the doctor can reach the organs easily. The doctor cuts into the abdomen and surgical tools are inserted. The fallopian tubes are cut, burned, or blocked with metal clips or plastic rings. The clips or rings are left in the body and stitches or staples are used to close the cuts. It usually takes a woman 4 to 6 days to return to her regular activities. With tubal ligation, contraception is effective immediately.
As a woman and a gynecologist, I am so supportive of the Essure procedure because I myself had sterilization the old-fashioned method. So I know what the recuperation was. Had I been given an option to have a sterilization, a permanent procedure without the added recuperation time and without incision, I would certainly have chosen that method.
Even if my husband would have had the vasectomy, who knows what could happen in life. So basically, I didn't want to have any more kids.
At the time I decided at the Essure procedure, I had been thinking about other options, including a tubal ligation at the birth of my second child, or possibly my husband having a vasectomy, or just staying on birth control pills. And after exploring the options and the long-term effects of each of those and what our objectives really were, and what I needed to really simplify my life, I decided on Essure.
My husband was very attracted to it just for the mere fact that he didn't have to have a vasectomy.
Actually, my husband and I considered a couple different options. The first option was a vasectomy for him, which I had scheduled 3 appointments at my doctor's office, and I had to cancel every single one of them because he got scared. So I went ahead and took matters into my own hands and decided to schedule something for myself.
In my experience with women, women like to take charge of their family planning method. And I find that when I offer the options of a vasectomy, which does carry an incision along with it, or Essure procedure, the patient will usually pick the Essure procedure because it's incisionless.
A man who goes through a vasectomy has to be off of his feet for at least 24 hours and then have limited activity for several more days after that. The Essure method of birth control is a non-incisional method, meaning somebody does not have to have a cut made in their body to get to the fallopian tubes. A scope is placed through a natural opening in the body, which is the cervix, and from there the doctor can see kind of the backside of the fallopian tubes and be able to place an insert, a micro insert, into each tube, and then over time that micro insert causes the tube to block, and therefore sperm and the egg can no longer meet.
With the Essure procedure, a small scope is used to deliver a soft, flexible micro insert through the vagina, into the uterus and into each fallopian tube. The spring-like micro insert expands during placement to fit the tube. A small trailing portion of the micro insert remains in the uterus and serves to verify placement. This portion will not irritate the lining of the uterus. Scar tissue grows into the micro insert, usually within 3 months, and forms a barrier so the sperm cannot reach the egg. Then at 3 months, the Essure confirmation test is performed. Dye is inserted into the uterus and an X-ray is taken to confirm placement of the micro inserts, that the tubes are blocked, and that you can rely on the Essure micro inserts for birth control.
My first reaction after the x-ray was done was happiness. I knew I was good to go. I knew I was free. No worries. No more pregnancies. Great sex. And that's it.
As a woman, I think it's very important that women make choices for themselves. As a physician, I can promise you that Essure offers a safe, effective method for those women seeking permanent birth control.